Sick, they do get grumpy too, apparently just like women and men. Dr. Lauren Crosby from Lapeer Pediatrics is with us here to take a look at over-the-counter medications and what you need to know before you give your kids these medications. I remember my pediatrician told me when I was raising my kids, they're not just small adults. They're different.
They're different.
So what do we really have to look at, and which medications are you most concerned about?
I think what's been coming up a lot now is we've been in cold and flu season, so it's all those cough and cold and decongestant medications, and parents wanting something so the child can sleep because they're coughing or they're cranky. But I think it's important to know what an over-the-counter or OTC medication is. It's a medication you can get without a prescription. But just because you don't need a prescription doesn't mean that it's a harmless medication. So there can be a lot of problems with them, either side effects, the kid can get jittery, or they can be hyper. They can also take too much and get ill. So you want to make sure you dose it properly.
Okay.
And that often means you need to ask your doctor, one, if it's okay to give it, and two, how much. Because a lot of the bottles say do not use under age 4 or do not use under age 2.
Is it okay to also ask your pharmacist? Because that pharmacist is right there.
You can ask the pharmacist. I think
not
with
the pharmacist
assistant.
I mean the pharmacist.
You have to and sometimes even a pharmacist, when it comes to babies and pediatrics, will still recommend you actually call your doctor because it's still different than adults, because some of the medicines are based on weight and not age and not recommended for kids.
We're showing aspirin there. Are you most concerned? I asked you. Are you most concerned about either the aspirins or the nonsteroidal anti-inflammatories?
The most important thing is you do not give actual aspirin to kids under age 18 because of something called Rye syndrome, which is also called hepatic encephalopathy. So you can cause liver failure and brain damage. No aspirin. And parents will say to me, I gave him aspirin. I'm like, no, tell me you didn't give him aspirin. You gave him Tylenol? You gave him acetaminophen, which is Tylenol, or ibuprofen. And usually they say, yes, I didn't actually give aspirin. But that's number one important to do. Two is to not overdose it or double dose it. One parent gives it, the other one gives it.
Do you really see that?
Yes, I do.
The parents don't even talk?
No.
Well, that reading the label isn't going to help that.
No, but sometimes, or they're staying at, oh, you're going to your dad's tonight. Here, take your medicine now. And then the dad gives the medicine because you're there and doesn't know. So it's really important to communicate. Write down what time you give these things to.
Okay.
People forget.
I'm going to move on to the next topic, but before I do, should parents buy pediatric medications whenever possible, or can they buy the adult versions and just lower the dose?
They can't use well, there's a couple adult ones that we will give a very specific dose to in certain circumstances, but it should be children's or infants and labeled properly that way. All
right, so your American Academy of Pediatrics just announced a different diagnosis I don't know, what do you call it?
Criteria.
Criteria, thank you, for earaches, ear infections.
For ear infections.
What is that?
Well, there were criteria in 2004, and basically what they're doing is reinforcing them, but also honing in a little bit more and making it more sort of a tighter way to diagnose it so that you don't have to use antibiotics as often. Because again, antibiotics, using them too much causes resistance, causes side effects, ear infections, a lot of complications. If you don't need them, you don't want to take them.
Well,
we're finding that 2/3 of kids can get over ear infections without an antibiotic.
2/3?
2/3, up to 2/3. So you want to treat their pain and treat fever with, ibuprofen, acetaminophen, and then come into the office in 48 hours if they're not better. But if it's an infant, you should come in. If there's a fever over 102 or more, you should come in.
Okay.
Or pain that is not relieved by those medications.
All right, if an infant, if the fever's over 102, and if the pain isn't relieved by the medications, but you said within 48 hours. When you say 2/3 tend to get better on their own without any antibiotics?
48 to 72 hours later, they're feeling better. So I will tell people, you can use, they'll say, do I need to come in? His ear's hurting, but I gave him ibuprofen, he feels better. I said, you know what? You could give it every 6 to 8 hours, and then stop it and see if the pain returns.
Okay. Dr. Lauren Crosby, thanks very much. Write it down, parents.